Good afternoon, everyone. Welcome to LUM TCM and Acupuncture Basics. Let's listen to Sir Dino Pinheiro from Legazpi for our first topic. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Continuation po sa Shui, Blood, Part 12.
Huwag mo na lagyan ng volume, ha? Huwag mo na maglagay ng volume.
It's both a pleasure and a fuel, and treat it as such. Overeating, eating too fast, preoccupation while eating, or eating at irregular times creates stress on spleen. You can support your spleen by enjoying your food, having a regular meal in a calm environment, eating away from stresses or distractions, eating slower, eating until you're about 80% full, planning meals, and eating a variety of foods. What to eat? So try to keep a balance. Ensure not to eat too much of any one food. Too much meat will weaken spleen and we will be unable to digest what we eat. Too many grains can create dampness. So there is dapat may variety and balance are the key. Try to include whole grains, vegetables like steamed in soup, baked or lightly sauteed 2 times a day. So avoid raw food, good quality sources of protein, yung beans, eggs, or meat. Increase food that are warm, build blood, and support the spleen. Avoid foods that are cold, raw, or damp. Foods and supplements that build blood. We have eggs, beef, chicken, liver, sea vegetables, seeds and nuts, beets, pumpkin, sweet potato, carrots, leafy green, oatmeal, brown rice, quinoa, beans combined with the grain, spirulina, blue-green algae, nutritional yeast, iron taken with vitamin C for better absorption, and vitamin B12. Damp food in excess. So we have alcohol, greasy, heavy, or oily foods, dairy products, refined carbohydrates like sugar, white flour, grains, tofu, or soy milk. Cold foods, iced drinks, beer, ice cream, raw fruits, and vegetables. Activities that relax and calm. So we can do meditation, gentle yoga, like Kundalini, restorative, or Yin, Tai Chi or Qigong, cooking, reading, walking, whatever works for you. Ease your mind. If anxiety and depression are persisting, consider seeking out a competent counselor, support group, or psychotherapist. Express yourself. Get your liver chi moving. Find healthy ways to express anger. Learn to express what you need. Work less. Look at your workload and do your best to make it a realistic one. Set boundaries and limit for yourself. Work less and work smarter. So tingnan po natin yung picture. Use fewer drugs or less alcohol. Do your best to sleep well. Set a bedtime for yourself. Make a bedtime a ritual. So regular po yung oras na susundan. Use your bed for sleeping, not working. So huwag tayong magtatrabaho sa bed or magbabasa or mag-aaral. Wake up at the regular times. Regular acupuncture appointments. With acupuncture, we use points to tonify spleen function so that we are getting the most out of our food in order to build blood We also use points to improve quality of sleep so that our body is better able to store blood. We work to calm the whole system down so that it can function more harmoniously. Next, we have Shiatsu. It's good for blood efficiency because it is comforting and relaxing. Sa habits which support digestion naman, all food should be easy to digest and cook. No raw food or salads, no cold foods. This means that just ice cream but salads, chilled foods, drinks, straight from fridge, and excess fruit in winter. Regular meals, regular pace of daily life, regular sleep, regular rest and relaxation. Enroll friends and family in supporting you in regularizing your habits. Soup made with chicken stocks. Add warming spices to food, cardamom, nutmeg, ginger, and cinnamon. Orange and yellow root and ground vegetables. Example, the carrot, pumpkin, parsnip, turnips, squashes, pumpkin are sources of natural sweetness, especially when chewed well. They provide best nourishment for spleen and help reduce sugar cravings. Foods to avoid: excess milk and cheese, refined sugar, chemicals in food, liquids with meals, junk food, bananas, peanuts. Food information produced by spleen and stomach and food, kidney essence, and formed in the heart. Blood function, nourished, moistened. Blood is also the basis for mental activities. Sa blood circulation, heart moves it, spleen produces it, and liver stores it. So we have, that's all. Thank you po for listening.
Thank you very much, Sir Dino. Up next is pathogenic factors, and this will be discussed by Ma'am Teresita Sumile from Rizal. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector, and good afternoon po sa lahat. Now let's continue our lesson on climatic pathogenic factors. Day 3 na po tayo. Our pathogenic factor now is cold. This factor mostly affects the organs of the water element, which are the kidney and urinary bladder. Our first tower diagram shows that yin is now at an exit state while yang is at a normal state. So there is a feeling of cold, stiff joints, shivering, increased urine, black ears. So treatment po natin dito is to sedate yin. Okay? Then the second tower diagram shows that both yin and yang are at an exit state. So symptoms are fever with chills, urgent burning urination, ear pain, pyelonephritis, cystitis following cold exposure, severe backache after cold exposure. So treatment po natin dito is to sedate yin. Then the third tower diagram shows that yin is still at an exit state while qi is now deficient. So there is kidney qi deficiency. So symptoms are edema and less urination, poor hearing, stiff joints, numbness, weak legs, backache when cold and at rest. The infection or inflammation may well remain, and only the functional qi decreases. So treatment po dito is to sedate yin and tonify qi. Sa last tower diagram, yin is at a normal state while qi is still deficient. So same as left chronic symptoms. So treatment po dito is to tonify the qi. Okay? Now, cold symptoms can manifest in any organ system. Symptoms of cold are contracting and retarding in nature. For example, the contracted posture, as in depression or ankylosing spondylosis, bradycardia, and others. Local treatment are moxibustion, light plum blossom tapping, and warming. Now we have here cold examples. Cold in kidney or urinary bladder. Our tower diagram shows that kidney yin is at a deficiency. At a normal state, while yang is at a deficient state. Now, there is a feeling of cold easily, especially when inactive. Lazy person, pain in back and knees at rest, cold feet, edema in ankles, long menstrual cycles, low libido, and poor hearing. So treatment po natin dito is to use UB23, which is the back shoe of the kidney 3 to tonify the yang, and then UB67, tonification point, and moxa on kidney 1 or kidney 3. Explanations: kidneys are in the lower part of the triple warmer, the part which acts as the fire for the cooking of the pot. When kidney yang is deficient, the whole day suffers the cold. But the most affected is the lower burner. The urinary and reproductive systems become cold, as this also retards their function. So it causes water retention, poor libido, and others. As the kidneys make bone marrow, coldness affects the bones and joints, causing stiffness and ache. Now let's go to damp cold in gallbladder. The tower diagram shows that blood is in an excess state while Qi is deficient. So symptoms are distension below ribs with greenish yellow colored watery stools when consuming milk products or fatty foods, pain in hip force when beginning to move from rest, and during rest and in wet, cold weather. So treatment po dito is to use UB19, needle and cup with moxa, which is the back shoe of the gallbladder. Gallbladder 37, the loop connecting point, and Li4 for better elimination of bile. Okay po, now, explanation. As coldness retards the function of organs, hypofunction of an organ is considered a symptom of coldness. Hence, warming the back shoe points of gallbladder would speed its function. A sluggish gallbladder would hold its bile and not eliminate it. Tapping therapy on the back shoe point would help to expel fluid from organs. Cold or damp can also affect meridians, causing the energy flow to become slow and stagnant. This would result in stiffness and pain in muscles at the beginning of movement. Thank you for your attention.
Thank you very much, Ma'am Teresita. We now proceed to yin and yang relationships. Our topic for this afternoon is interconsumption. So the first example for interconsumption is yang consuming the yin. As you can see on the first tower diagram, there is increase of yang or heat. This is heat because of exposure to heat over a period of time. So it is a natural reaction for the yin to increase at first because there is increased yang. After a short period, the yin will be consumed, so there will be dryness, loss of weight. This is deficiency of yin caused by exposure to yang factors over a period of time. These yang factors could be stress, exposure to excessive climatic heat or fever, excessive alcohol consumption. The body has to supply the yin from the interior in order to control the excess yang. After a point, it is only natural that the yin will be exhausted. So this will manifest symptoms like loss of fluid, loss of weight, malnutrition, or reduction of substance or structure. Clinically, there will be dryness, weakness, exhaustion or burnout, loss of weight, and poor endurance. Treatment: tonify yin, sedate yang. This is a subacute state where the yang pathogenic factor has made a lasting damage to the yin of the body. This is caused by a substantially strong yang or a longer period of disease, like high fever, prolonged and regular consumption of alcohol. What does yin deficiency mean? This means that much fluids, nutrition, and sleep are needed to improve this luck. And unfortunately, this cannot be substituted by anything else. The tonification with needles will actually help the body with absorption and distribution of nutrients and fluids. We can also improve appetite, digestion, thirst, and the quality of sleep with acupuncture. Let's go to another example. This time we have yang consuming the yin. Example 2. So we have a case of bacillary dysentery following food poisoning. When yang increases because of infection, the yin increases to contradict it. Hence, watery stools will follow. The infection is similar to a blazing fire where water is needed to extinguish it, and the body releases its fluid to control the heat. As the diarrhea continues, the patient becomes dehydrated and the stools become smaller and are accompanied by mucus. Sometimes the patients pass only blood as the body tries to eliminate heat by bleeding, as it is unable to balance the heat by increasing the yin. Blood not only circulates nutrients throughout the body, blood also circulates heat. If blood does not reach our fingertips, they would remain cold. But when there is too much heat in any part of the body and there is insufficient fluid to cool this heat, simplest way to reduce the heat is by dispersing the heat to the outside. So this is done very quickly and effectively by the body, by bleeding. Examples: nosebleeds, coughing blood in tuberculosis, vomiting blood in stomach ulcer, excessive bleeding, not clotty in menstruation, and hemorrhoidal bleeding. Treatment: sedation of yang, tonification of yin in the large intestine. Balance the fluids and salts with infusions if necessary. Excessive spontaneous bleeding shows two problems. There is too much heat or there is insufficient fluid. As long as the body has enough fluid, it will react with fluid, not blood. Now let's go to example number 3. This time we have alcohol intake. Alcohol increases liver yang. This is, I think, very common. Initially, the liver yin can increase. So there goes your hangover. In due course, liver yin is consumed, causing symptoms of contractures of muscles and tendons, tremor, dry eyes, lack of control over anger. Deficient liver yin cannot control the rising liver yang. Liver yin stores blood. So when yin is deficient, there could be spontaneous and excessive bleeding, as in the case of liver cirrhosis. A reduced state of blood, and so we have another tower diagram which is showing to us the end result of excessive bleeding, like you'll have reduced state of blood and qi. Treatment: sedate liver yang and tonify liver yin. Points to hold the blood within vessels, and other points against alcohol abuse. Thank you very much for your attention. We now proceed to 5 elements, and let's call once again Sir Dino Pinheiro from Legazpi to continue his discussion on the fire element. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Okay, we continue sa fire element part 3. The heart governs speech. A person with a good heart chi will be able to communicate excellently with anyone, with or without knowledge of their language. Another person who is very learned might still have a problem communicating simple messages to others. In communication, the expression is yang and the contents are yin. Those who are able to speak eloquently and non-stop, dramatically in a way that is enthralling to listen to and watch are heart yang excess personalities. Their heart chi is abundant, and if they cannot maintain talking in this way and continuing to inspire others, then the heart blood and yin are weak. If their speech is full of empty eloquence and does not contain many ideas, it indicates a lack of substance and a yin deficiency too. If a person has much to say but finds it difficult to express themselves, it indicates heart chi deficiency. Speech can be improved with practice, yung sa function, which also increases one's confidence, yung yang. There are people who ramble on with nothing to say, and whatever they do say, they say it badly. They contradict themselves, mix issues, and have problems answering questions. This is a leakage where both heart, blood, and chi are low and incontinent. Sa speech, fast with many hand gestures, high voice, meaning there is a heart chi and yang is increased. Devoid of information but entertaining, there is a yin deficiency. With much information as well, there is a yin increase. Slow, monotonous, hesitant, robotic, meaning there is yang deficient, chi deficiency, pababa. Verbose, rambling, yin deficient, yang deficient, ibig sabihin there is a leakage. Sa voice naman, the abduction and adduction of vocal cords is related to the tone of the voice and therefore the heart yang and chi. High tone, yang increase, deep tone, yang decrease. Rap, hoarse, there is yin decrease. Weak voice, paralysis of vocal cords, ibig sabihin there is yin and yang deficiency. Heart opens to the tongue. The actual nature of protrusion of the tongue shows the character of the person rather clearly. Strong protrusion indicates an extroverted person, and shy, mild protrusion, an introverted character. The color of the tongue, one should consider mainly the front of the tongue, as this is the part that is related to the upper wormer. The color in this area shows the state of the blood, energy, and fluid in the heart. Pag red tongue, there is yang increase. Pag palang tongue, yang is deficient or blood deficiency. Pag red papillae, there is yin deficiency but increased yang. Pag purple ang tongue, there is blood stagnation with chi deficiency. The use of tongue in speech is very important. A person who stammers has yin deficient of the heart, and stammering is worse in nervous. There is yang increase situation. Slurring or lisping, however, are more decreased in chi of the heart, as in any problems with clearly enunciating words. Tongue is the mirror of the heart. Nevertheless, the tongue also shows the condition of the blood, energy, and body fluid of other organs of the body. So yung likod ng tongue represent the urinary system, reproductive system, and the lower burner. Like yung back of tongue, kidneys, urinary bladder, lower warmer. Yung middle warmer naman, yung middle of tongue, yung liver and gallbladder, and sa tip of tongue, yung upper warmer, yung heart and lungs. Spleen, stomach, liver, gallbladder, small and large intestine, yung middle warmer, while yung tip, yung upper warmer, ang heart and lungs. So thank you po for listening.
Thank you very much, Sir Dino. Up next is Jing or Essence. Let's call once again Ma'am Teresita Sumile for the presentation. Good afternoon po ulit, Ma'am Teresita.
Good afternoon po ulit, Dr. Hector, and good afternoon also to my classmates. Jing Essence, Day 3 na po tayo. Fire of Gate of Life. It is situated in between kidneys. Physiological fire of body which provides warmth, essential for all body's physiological processes and for all internal organs. It is already present from birth and from conception. Pre-heaven essence present from conception and birth, but it then matures into kidney essence at puberty when it generates menstrual blood in ova in women and sperm in men. Okay? Now, fire of gate of life represents young aspect of pre-heaven essence and pre-heaven essence proper transforming into kidney essence at puberty represents yin aspect. Now here it is illustrated that conception essence of the fetus comes from yang essence of the father and yin essence of the mother. Then the yang aspect of the fetus from birth represents the fire of gate of life. And the yin aspect represents pre-heaven essence. And pre-heaven essence matures into kidney essence upon puberty. And it generates menstrual blood for women and sperm for men. Okay? Now, fire of gate of life. As illustrated, it accumulates at 0.24 Mingmen on spine at conception. And pre-heaven essence concentrates at 0.34 1U1 also at conception. Okay pa? Fire of gate of life. It correlates with uterus where menstrual blood is stored in women and with room of sperm in men. Residence of mind and essence connected to original chi or yuan chi. In men, it houses sperm, and in women, the uterus. Now, pre-heaven essence, since it is inherited from parents at conception, pre-heaven essence can be influenced only with difficulty in course of adult life. Some say this is fixed in quantity and quality. Due to its interaction with post-heaven essence, it can be positively affected even if not quantitatively increased. Best way to affect positively one's pre-heaven essence is by striving for balance in one's life activities, balance between work and rest, restraint in sexual activity, and balanced diet. Any irregularity or excess in these spheres is bound to diminish pre-heaven essence. Direct way to influence one's essence positively is through breathing exercises. Next slide, please. Post heaven essence is the essence refined and extracted from food and fluids by stomach and spleen after birth. Newborn baby starts taking nourishment and breathing. His lungs, stomach, and spleen start functioning to produce qi from food, drink, and air. Pre-heaven essence originates from parents. Post-heaven essence originates from food. Okay po? So thank you for your attention.
Thank you very much, Ma'am Teresita. We now go to the next topic, the Zangfu organs. And this time, we talk about the stomach. Functions of the stomach. Stomach is responsible for reception and ripening of food. Stomach begins transformation of food by separating food into pure and impure aspects. The pure parts, which are called the nutrients or the essence, are sent to the spleen, while the impure parts are passed on to the small intestine. Since food, after decomposing in stomach, passes on to intestines, the stomach governs downbearing of turbid. This downward action stands in complementary opposition to the spleen function of extracting the essence. Spleen governs upbearing of the clear. Stomach and spleen stand in exterior-interior relationship and are the basis for the postnatal qi. Stomach is referred to as source of fluids, sea of grain and water. It requires fluids to prepare food for spleen. Fluid deficiency or body fluid deficiency, yin deficiency, impairs production of liquids or fluids. All organs involved in fluid production can be affected. Let's talk about relationships with the stomach. Between spleen and stomach. Spleen and stomach, they stand in interior-exterior relationship. Physiologically, spleen governs TNT, or transportation and transformation, and stomach governs intake. Stomach and spleen complement and counterbalance each other. Although stomach disorders have to be differentiated from spleen disorders diagnostically, it is often seen in daily practice that disorder of either spleen or stomach affect the partner organ as well. Stomach and liver. Liver governs harmonious flow of qi. If energy and emotions flow freely, harmonious digestion can happen. If liver's free coursing action is impaired, the depression of liver qi will affect the digestive function. So this is a situation where we have a liver attacking the stomach. Let's talk about stomach pathology. Deficiency patterns are stomach qi deficiency and stomach yin deficiency. Excess patterns, rebellious stomach qi, stomach cold, stomach fire, retention of food in the stomach, phlegm heat in the stomach. In stomach qi deficiency, stomach qi is weakened. the stomach function of food intake and decomposition is impaired. Stomach qi deficiency and spleen qi deficiency are connected closely. Stomach qi deficiency can be considered an initial stage of stomach cold. Cardinal symptoms: fatigue, lack of appetite, decreased thirst, loss of taste, soft stool, uncomfortable feeling in the epigastrium, better with touch because this is a deficiency condition. Empty pulse and stomach position. Stomach Yin deficiency is the initial stage of stomach fire. Cardinal symptoms: hunger without appetite, thirst without desire to drink, dry mouth, constipation, pain in the epigastrium, vertical tongue cracks, no tongue coating. Now let's talk about rebellious stomach qi. There is impaired harmonious downbearing of the stomach. Stomach qi is ascending and counterflows opposite to its normal direction. Cardinal symptoms: nausea, vomiting, belching, hiccups, heartburn. Stomach cold is the result and further complication of stomach qi deficiency. So if you have stomach qi deficiency, initially, if unresolved, it can progress to stomach cold. Cardinal symptoms: you'll have stomach pain relieved by warmth, preference for warm drinks and food, absence of thirst, vomiting of clear liquids. Stomach fire. This is the result and further complication of stomach Yin deficiency. Cardinal symptoms: thirst, desire for cold drinks, bad breath, burning pain in epigastrium, excessive appetite, bleeding gums. Now let's go to retention of food in the stomach. This arises when food is not decomposed in the stomach and is attributed to dietary irregularities like voracious eating and drinking. Cardinal symptoms: vomiting after eating, pain in epigastrium that worsens with eating, loss of appetite, sensation of oppression and fullness. Now let's talk about phlegm heat in the stomach. This can develop from stomach fire or from damp heat in the spleen. Heat condenses dampness into phlegm. So if you have dampness, this will definitely go to phlegm. This will transform to phlegm eventually. Cardinal symptoms of phlegm heat in the stomach: burning pain in the epigastrium, feeling of oppression in the epigastrium, yellow tongue coating, mouth ulcers. Thank you very much for listening. Next, we go to meridian theory. Let's welcome once again Sir Dino Pinheiro. Sir Dino.
Hey, good afternoon, Doc. Good afternoon po sa lahat.
Good afternoon.
Okay, we could continue sa stomach channel of Food Yang Min Part 3. Okay. We have this stomach 39. Observe po natin dito sa picture. The location, 1 tune distal to stomach 38. So nasa baba siya ng stomach 38. Midpoint, ang stomach 38, midpoint of the line joining stomach 35 and stomach 41. And 1 finger breadth lateral to the anterior crest of the tibia. Yung point explanation, similar to stomach 37, this is the lower C point of the small intestine and is used for influencing its function. It is especially effective in the treatment of colic, young diarrhea, and pain in the small intestine. When used with sedation technique, it can also be given with tonification technique when treating distension and malabsorption diarrhea. Next point, we have stomach 40. Tingnan po natin yung illustration which is nasa midpoint ng stomach 35 and the lateral malleolus. Sa location, at the midpoint of the line joining stomach 35 and stomach 41, 2 finger breadths lateral to the anterior crest of the tibia or 1 finger breadth lateral to stomach 58 between the extensor digitorum longus and peroneus brevis muscle. This point is the loop connecting point. It is said that one of the earliest changes in aging, which begins around 35 to 40 years old, is the decreasing of spleen and stomach function. So, nasa age 35 to 40 years old, decreasing na po ang spleen and stomach function. This causes poor digestion and absorption and distribution of nutrients, poor circulation of thick fluids in our body, and therefore stagnation of these thick fluids in various parts of the body. This causes dampness, which manifests as edema, stiffness of joints, mucus condition in the respiratory organs, sluggish functioning of the organs, feeling heavy and lethargic. These symptoms are treated by changing one's diet to include more whole meal, grains, eating warm and cooked food, avoiding refined carbohydrates and sweets, fatty dairy products, and so on. The best point used in this case are stomach 40, spleen 9, UV 20, and the Bakshi point of the spleen to improve the function of these two organs. Point stomach 40 is considered symptomatic point for dampness and improved circulation of thick fluids. Next point, we have stomach 41, which is located on the front of the ankle at the level of the line, joining the prominence of the lateral and medial malleoli, in the depression between the tendons of the extensor digitorum and extensor hallucis longus. Ang point is used sa tonification point of the meridian. It is good for improving hunger and appetite. So check po natin sa picture, nasa may dorsal ankle joint. Next point, stomach 42, which is located on the highest point of the dorsum of the foot, between the tendons of the extensor hallucis longus and the extensor digitorum longus, directly lateral to the point where the dorsalis pedis artery may be palpated. The point is bordered proximally by the second and third metatarsal bones, and distally by the second and third cuneiform bones. Alternative locations, sometimes this point may be located lateral to the medial portion of the extensor digitorum longus tendon, joining the second toe. This point is the U1 source point of the stomach meridian. It is used sometimes to sedate stomach yang in conjunction with the loop connecting points of the spleen, which is the spleen 4 or spleen 21. Next point, we have the stomach 43. Check po natin yung picture, which is located on the dorsum of the foot, in the depression distal to the junction between the second and third metatarsal bone. This point, the wood, which is the wood point and grandmother point of the stomach meridian. It is one point on this young meridian which actually tonifies its yin. Therefore, it can be used successfully in reducing acidity, vomiting, and upward dispersion of the stomach, and makes the food flow downwards. Next point, we have the stomach 44. Check po natin yung picture, which is located between the second and third toes, proximal to the interdigital fold. Ang point is commonly used, meridian distal point and a pain relief point. It is especially effective in treatment of pain along stomach meridian regions of the face, the temple, TMJ joint, and lower jaw, and the treatment of lip problems. It is also the water point of the meridian, which means it can serve as a sedation point. Next point, we have stomach 45, which is located on the second toe, point 1 tune from the lateral corner of the nail. Itong point is the sedation point and metal point of the stomach channel. Often, it is not used for sedation because it is the core. In such case, sedation of stomach 44, the water point, so we use stomach 44 instead of stomach 45, would be just as effective but not so painful. So thank you po for your attention.
Thank you very much, Sir Dino. We now come to the last topic, which is still on breathlessness. Still on patterns, part 3. Now let's talk about phlegm heat in the lungs, clinical manifestations, cough, breathlessness, pain in the chest, profuse sticky yellow or blood-tinged sputum, irritability, feeling of oppression in the chest, feeling of heat, sweating, thirst, red face, dry throat, dark urine, constipation. Tongue is red with sticky yellow coating. Pulse, slippery, rapid. This pattern corresponds to the stage following invasion of wind cold or wind heat, when the pathogenic factor turns into heat and it settles in the lungs. All the symptoms point to lung heat. This pattern occurs after an invasion of wind when the pathogenic factor changes into heat, penetrates interior, and combines with phlegm. In such cases, it is the cause of acute breathlessness. Phlegm heat in the lungs is also a very common residual pathogenic factor in the lungs in chronic breathlessness. It occurs at any age, from childhood to old age. Treatment principle: clear heat, resolve phlegm, clear the lungs. Points: lung 5, lung 1, LI 11, stomach 40, do 14. Reducing method: no moxa. Lung 5 clears lung heat. Lung 1 clears lung heat and relieves fullness and pain in the chest. LI 11 clears heat. Stomach 40 resolves phlegm. Do 14 clears heat. Turbid phlegm in the lungs, clinical manifestations: breathlessness, difficulty in breathing out, feeling of oppression and fullness of the chest, cough with profuse sticky white sputum, vomiting or nausea, sticky taste, no thirst. Tongue, swollen body, thick sticky white coating. Pulse, slippery, full. This condition is characterized by retention of damp phlegm in the lungs. Damp phlegm severely obstructs the sending of lung qi, resulting in cough and breathlessness. Phlegm also impairs qi circulation in the chest, thus causing feeling of oppression and fullness of the chest and nausea or vomiting, as it also prevents the sending of stomach qi. Treatment principle: resolve phlegm, restore the sending of lung qi. Points: lung 5, lung 7, lung 1, pericardium 6, stomach 40, spleen 6, ren 9, bladder 13, bladder 20. Reducing or even method except on bladder 20, which should be reinforced. Lung 5 and lung 7 expel damp phlegm from the lungs and restore the sending of lung qi. Lung 1 relieves the feeling of oppression of the chest. Pericardium 6 relieves chest fullness, stops nausea or vomiting, and opens the chest, facilitating expulsion of phlegm. Stomach 40, spleen 6, and Ren 9 resolve phlegm. Bladder 13 stimulates descending of lung qi, while bladder 20 tonifies the spleen to resolve phlegm. Thank you very much for your attention, and we hope to see you next time. Good afternoon, everyone.